Are you getting bills from providers for what has been considered in the past preventative healthcare measures? As a rehab therapist, I usually focus on education for skilled nursing rehab and how Medicare is severely restricted these days. But this is something that is and will affect everyone, not just those on Medicare. This change in the Affordable Health Care Act was not plastered all over the news media and is not discriminatory between Medicare or commercial health care insurance. Today, I want to make people aware of one of the ways insurances are dipping into everybody's pocket. Stick around for a reveal that can affect everyone, especially those of us who religiously go every year for our wellness physical. Well, to prevent from any illness from settling into our bodies, right? And stay well. Stick around. Welcome back, YouTube, and thanks for being here. I have some valuable insight that will help prevent an expensive cost to you for procedures that have been past practice to be included in a yearly wellness exam year after year. Well, one thing we can be sure of is that the only thing that remains the same is change. That and the fact that healthcare is big business with the purpose to profit. The medical community has me trained, and I'm sure others of us as well, to be proactive with our health. In addition, insurance providers have pushed for us to be proactive as well, to save them money due to late diagnosis of an illness that could have been prevented, saving them money in the long run. Over the years, I have educated many patients on this as well. So year after year, my doctor will call with a friendly recording to remind my husband and I it's time for our yearly wellness exams. Now, for the past 4 or so years, I have had difficulty with what I thought was how my doctor was billing my blood work. You see, there is a difference between preventative and diagnostic codes. It can be the exact same procedure, the exact same test, but if it was preventative, it was covered, and if it was diagnostic, it was not. Now, I don't know if you've noticed, you do not get a detailed bill any longer. By that I mean that each current procedural terminology, or what is more commonly called CPT codes, that were specifically billed for. It would be like going to the grocery store and buying milk, cheese, ice cream, and coffee creamer, and the bill would just give you a lump sum amount due and call it dairy. So on the explanation of benefits, it will only state laboratory and the date the service was provided. This is evident in both my explanation of benefits and the provider billing, the provider being who performed the lab work. There is not anywhere we are given exactly what they are testing for or billing for. Let's take a look. Now, imagine my surprise when my husband received a bill from our provider, Munson Healthcare, who performed the blood work for over $800. Now, this is how the billing looks. Absolutely no delineation of what the physician office lab was. You are not able to see what they were testing for, what each test cost, just how much you owe on this. Upon closer inspection, I see this is for his 2022 physical and 2023 physical. We did not receive a bill before this for anything from his physical in 2022. Now I have asked both the insurance, which we have United Healthcare and Munson, for a detail of the CPT codes that were used to determine this lab fee. Do you know they say they can vaguely tell me, but no one can provide me with a printout of exactly what they are charging. At one point, the United Healthcare rep told me the doctor reported he complained of fatigue, and that is why the lab work was ordered. It was never said anyone was tired or had been experiencing any type of difficulty with fatigue. At the recommendation of the United Healthcare representative, we went online and appealed the charges, claiming all of this was for his yearly preventative physical. So here's what United Healthcare had to say in the appeal. We understand the appeal to state that this service should be eligible for reimbursement because it was preventative in nature. Now they claim screening of vitamin D level without suspicion of disease associated with low vitamin D is not considered medically necessary. Now, due to my husband being older and a cancer survivor, we both do take a daily vitamin D supplement. Here's a fun fact published in the Journal of Aging and Gerontology, and I quote, "Vitamin D toxicity is caused by excessive ingestion of vitamin D supplements over an extended period of time. Clinical signs and symptoms of vitamin D toxicity are often vague, have been attributed to cardiovascular and kidney damage. Now, the insurance company has parameters for what they consider medically necessary. Medically necessary needs to be consistent with the symptoms upon which the diagnosis and treatment of the illness or injury is based. Now, I don't know about you, but if this physical is to make sure everything is fine, exactly what will insurance cover? My blood pressure? I would say my oxygen saturation levels, but I have paid $6 for quite a few years for that as well. I threatened the nurse that I would bring my own pulse oximeter and just tell her what it is. I mean, really? This is so petty. But no company makes money being practical. Provided by a practitioner, hospital, or covered provider. Now we may be on to something, as this was provided by a practitioner, but it may just have to encompass every medical necessity for them to cover a physical. Approved by the U.S. Food and Drug Administration, FDA, if the drug or supply is appropriate for review by the FDA. Now, this is the one that could zing a lot of people because some doctors prescribe medications for what the side effects are. Like, for example, certain antidepressants that will stimulate an older person's appetite. I am not a doctor, but this is a very common occurrence. Not provided primarily as a convenience to the patient, practitioner, hospital, or covered provider. This one could get sticky as well for some people because I do know there are folks who do have oxygen tanks for comfort, not necessarily for low oxygen levels. Now United Healthcare was so generous to tell us they applied the expenses to his deductible. Thank you, United Healthcare. Now, not to deviate from the issue of preventative care not being covered, but I want to present this in the order of the material dated in an attempt to understand just how this all came about. In February 2022, the Chief of Infectious Diseases at University of California, Davis published an article indicating that people with a vitamin D deficiency are more likely to develop a severe or critical case of COVID-19 compared to people who had sufficient levels of the vitamin in their blood. Patients who were deficient were 14 times more likely to have severe or even critical COVID-19. Wow, that sounds like something simple could help people. One would think it would be more cost-effective to monitor vitamin D levels than place people on ventilators, right? Again, in February 2022, United Healthcare reported that beginning March 1st of 2022, they will no longer be including vitamin D testing in routine preventative screening. You must ask yourself, what is the coincidence of correlation to COVID-19 findings? What I've found is that preventative will continue to cover vaccinations. Oh, really? Because now I recently heard that COVID vaccines may be yearly, if not more frequently, like quarterly. Be mindful because there is big business in vaccinations. One would think that maintaining a healthy vitamin D level would be more cost effective than manufacturing, educating, and dispensing vaccines. I have done some research and it took a lot of digging to find barely a mention of a court ruling that apparently occurred in March 2023. At the end of March of 2023, a U.S. judge rules insurers don't have to cover many free preventative health services. This was posted in the Kansas Reflector. According to the author, numerous medical groups warned against revoking this coverage, that this coverage has been shown people have benefited from no-cost preventative coverage. The next day, the New York Times reported the same, identifying the Texas district judge who ruled that it is unconstitutional to dictate what benefits health insurers must cover. Now, I did not include all the material that debates another decision that United Healthcare was going to make a move on in 2022. But United Healthcare wanted to deny any emergency room visit if it turned out that it wasn't a real emergency. Really? According to United Healthcare, they have dismissed the idea. But I assure you, when the fire cools down, you can bet they will try again. So what this means is that if you have an angina attack, which usually causes chest pain and can easily be mistaken for a heart attack, and you go to the ER and it's not a heart attack, you are on the hook for thousands of dollars. I mean, the ambulance ride alone can be upwards of $1,000. I did another video about Humana, who made $2.8 billion in profits in 2022, paid out $448 million in dividends to shareholders of their stock, and more than $17 million in compensation to its CEO. I mean, really? I'll add a link at the end of this video for you. I don't want United Healthcare to think I singled them out. So the point of this is that when one gets away with it, they all follow suit. Let's look at United Healthcare stock. United Healthcare stock is trading at $505 a share with 926 million shares owned by investors. They are also on track for the biggest gain in over 2 years. Do you see that not only do we pay for this coverage, but we give them more money on top of premiums so they can have bragging rights? United Healthcare value has doubled since 2018 and continues to grow as they continue to cut coverage. I appealed this charge twice, and United Healthcare tells me I have exhausted the appeal process. This is a response I recently received from United Healthcare. The new Patient Protection and Affordable Care Act, often called healthcare reform, has changed the way United Healthcare can consider preventative services under this plan. You know, my point is that I don't think most people go looking for this information until they're caught in the financial trap. The media are not bringing this to our awareness so we can be better prepared. Now I'm holding an $800 bill. In Michigan, insurance can go back 1 year to bill services. So even though they covered it in 2022, they took it back in 2023. Looking at the timeline, it may appear that the Affordable Health Care Act was unconstitutional because we were becoming too healthy. I mean, if sufficient vitamin D levels can help lessen the risk of severity of COVID, then why do away with preventative services? On the other hand, if you want to sell more vaccines or increase the probability of another wave, then of course you can have record-breaking years. Moderna and Pfizer stocks spiked during 2021 and 2022, making billions for these companies. Let's look at Moderna, who recently reported their earnings and projections. You can see for the second quarter of 2023, Moderna shows a $1.4 billion loss. Yet here they expect 2023 COVID-19 sales of $6 to $8 billion. Moderna is already developing another vaccine for the next stage in COVID. Wouldn't it just be easier to give everyone vitamin D? Here you can see Moderna is going to couple COVID-19 vaccine with the seasonal flu vaccine. I mean, why not? We have already been trained to get that every year for over 20 years. The preventative covered services were working and doing what they were designed to do. Multiple medical groups warned against revoking these services. One way we can attempt to limit being blindsided by costs that we were believed to be what was once considered preventative is to request pre-authorization. This can be accomplished by contacting your doctor and requesting that your visit receive pre-authorization from your insurance company prior to your visit. To do this, just call your doctor prior to your appointment, tell them you would like your visit pre-authorized and you would like a copy of the pre-authorization. The pre-authorization process will require at least 1 week. I just contacted my dentist and they informed me that they were requiring about a week and a half for insurance to respond. Then you can determine if you want any of the services that are not covered. I understand that emergencies arise and we will be at their discretion for what they may or may not pay. If we can attempt to control what is within our control, it may help limit the financial damage from these charges. I would also suggest that when you receive a bill, you match it up with your explanation of benefits and demand a breakdown of the charges from the provider before you pay any bill. I'm just amazed at the boldness of these companies to just send out a bill and demand payment. We have the right to know what we are paying for, and the more they are allowed to expect blind payments from us, the more we are allowing them to establish this practice. I am an army of one, but I would ask you leave a comment with any experience you have encountered regarding these chargebacks for what once was preventative care. Please hit the like button so others will be able to find this content, and please subscribe if you have not already done so. If you're interested in a short video on how Humana has profited in 2022, click the link coming up.